Well, in the COMPARE trial, we actually studied the Ranger DCB and the Impact DCB, and they do have profound differences with respect to their coating technologies. So one important difference was the Paclitaxel dosage. For the Ranger DCB, it's 2 microgram per square millimeter, and for the Impact DCB, it's 3.5 microgram per square millimeter. Importantly, they also do have differences with respect to the carrier that was used. I think it's a typical femoral popliteal disease study population. So we included patients with symptomatic femoral popliteal disease presenting in Rutherford category 2 to 4. So we did not include critical limb ischemia with respect to tissue loss. The design of the study, it's an investigator-initiated randomized controlled trial with a non-inferiority design. So today we presented the primary endpoints with respect to safety and efficacy. For the efficacy outcome, we looked at primary patency through 12 months. And actually we had a really excellent primary patency rate for both devices, over 80%, and the non-inferiority endpoint was met for efficacy. Safety was freedom from major adverse events at 12 months, and also here the primary non-inferiority endpoint was met. Well, this is actually the first head-to-head comparison of 2 drug-coated balloons in the field. So far, we only could rely on meta-analysis making indirect comparisons between the devices. And interestingly enough, they actually suggested a better efficacy of a higher drug dose. So I think it's really important that this is a head-to-head comparison showing comparable effectiveness and safety of 2 drug-coated balloons. Well, of course, we are all aware of the mortality signal, and I'm not going to tackle this one. I think what we need for devices in general is really head-to-head comparisons, so to go for comparative effectiveness, and of course to follow up our patients for a longer time period. So also in the COMPARE trial, we are actually performing a 5-year follow-up for safety events.